Histology and Anatomy of the Distal Convoluted Tubule. Welcome, medical students, to today's lecture on the histological and anatomical features of the distal convoluted tubule, DCT. The DCT is a crucial component of the nephron, responsible for fine-tuning the composition of urine by regulating the reabsorption and secretion of various solutes. Throughout this lecture, we will delve into the intricate details of DCT structure, function, and regulation. So, let's begin our exploration of the microcosm within the kidney. The DCT is located in the renal cortex and extends from the macula densa, a specialized region in the walls of the thick ascending limb of the loop of Henle, to the initial part of the collecting duct system. Histologically, the DCT exhibits a distinct arrangement of cells and unique structural features. Its epithelial lining is composed of cuboidal cells with microvilli, providing an increased surface area for transport processes. Additionally, the DCT possesses fewer mitochondria compared to the proximal convoluted tubule, reflecting the diminished reabsorptive capacity in this segment. The DCT receives its blood supply primarily from the efferent arteriole of the glomerulus, which gives rise to the peritubular capillaries. These capillaries intricately surround the DCT segments, facilitating efficient exchange of solutes with the tubular lumen. This close association between the peritubular capillaries and the DCT aids in reabsorption and secretion processes, ensuring the maintenance of homeostasis. The ultrafiltrate, which enters the DCT from the proximal tubule, undergoes significant modification within this segment. The DCT is impermeable to water under basal conditions, but it actively reabsorbs sodium through the epithelial Na+/Cl cotransporter, NCC. This transport mechanism is crucial for maintaining sodium balance and blood pressure regulation. Furthermore, the DCT also has the ability to reabsorb calcium through the transient receptor potential vanilloid type 5, TRPV5, channels, ensuring proper calcium homeostasis. The active reabsorption in the DCT is mediated by several key transporters and channels. The NCC, as mentioned earlier, facilitates the reabsorption of sodium, whereas the apical epithelial calcium channel, ECAC, is responsible for calcium reabsorption. Additionally, the ATP-driven basolateral sodium/potassium pump creates a favorable electrochemical gradient for sodium entry across the apical membrane. These coordinated mechanisms ensure efficient ion transport and contribute to the regulation of fluid and electrolyte balance. While active reabsorption is the dominant mechanism in the DCT, passive reabsorption of certain solutes also occurs. Passive reabsorption primarily involves the movement of moderately sized solutes such as urea, uric acid, and small peptides. Through passive paracellular pathways, these solutes move across the tight junctions between adjacent tubular cells. This process occurs in response to the osmotic gradient generated by the active reabsorption of sodium and other ions. In addition to reabsorption, the DCT participates in the active secretion of various organic ions and waste products into the tubular lumen. This active secretion occurs through specialized transporters, such as the multi-drug resistance protein 4, MRP4, and the organic anion transporter 1, OAT1. These transporters contribute to the elimination of toxins and help maintain overall body homeostasis. The hormonal regulation of the DCT is predominantly mediated by aldosterone and parathyroid hormone, PTH. Aldosterone, secreted by the adrenal cortex, enhances sodium reabsorption and potassium secretion in the DCT, thereby influencing blood pressure and electrolyte balance. On the other hand, PTH fine-tunes calcium reabsorption in the DCT by modulating the activity of TRPV5 channels. The dynamic interplay of these hormones ensures precise regulation of DCT function. The DCT plays a pivotal role in maintaining acid-base balance within the body. By regulating the reabsorption and secretion of hydrogen ions and bicarbonate ions, the DCT helps maintain physiological pH levels. Acid-base imbalance, such as metabolic acidosis or alkalosis, can disrupt DCT function and have widespread effects on the body's homeostasis. Electrolyte balance, particularly the regulation of sodium, potassium, and calcium, is crucial for various physiological processes. The DCT actively participates in maintaining electrolyte balance by fine-tuning their reabsorption and secretion. The coordinated actions of transporters, channels, and hormonal regulation ensure precise control over electrolyte levels, preventing their excess or deficiency. Dysfunction of the DCT can lead to various clinical manifestations. For example, defects in NCC function may result in Gittelman syndrome, characterized by electrolyte imbalances and low blood pressure. Conversely, mutations in TRPV5 channels can lead to impaired calcium reabsorption, causing disorders such as hypocalciuric hypercalcemia. Understanding the clinical implications of DCT dysfunction aids in the diagnosis and management of these conditions. The DCT and the loop of Henle work in tandem to ensure efficient urine concentration and electrolyte balance. The reabsorption of sodium by the DCT is dependent on the sodium gradient established by the loop of Henle. Conversely, the loop of Henle relies on the DCT for successful dilution and concentration of urine. These interactions and coordination between the DCT and the loop of Henle are vital for maintaining overall renal function. Advancements in technology and experimental techniques have provided valuable insights into the intricate workings of the DCT. Techniques such as electrophysiology, immunohistochemistry, and molecular biology have unraveled the molecular mechanisms underlying DCT function. By studying these advanced techniques, researchers can further enhance our understanding of DCT physiology and contribute to the development of novel therapeutic interventions. The distal convoluted tubule, DCT, is crucial for maintaining balance in the body. By controlling what is reabsorbed and secreted, it helps keep our kidneys functioning well. Understanding its functions and interactions is essential for diagnosing and treating renal disorders.